I'm Joni Slagle, and I'm here to discuss with you the benefits of implementing chronic care management into your primary care practice. What is chronic care management? It is services offered to the Medicare population that provide them with improved quality of care and management of their chronic conditions. In 2015, Medicare recognized chronic care management as a critical component in improving the healthcare outcomes of that population. They have some stipulations and requirements for enrolling patients in chronic care management. The patient has to have at least 2 chronic conditions, and these conditions must be at risk of patient exacerbations, decompensation, or functional decline. You also must have a comprehensive care plan written for the patient. Disease processes like atrial fibrillation, cancer, cardiovascular disease, diabetes, and high blood pressure are all conditions that would qualify a patient to be enrolled in this program. But they're not limited to those disease processes. Those are just to name a few. I currently work as a chronic care management nurse in a primary care practice, and I've done this for about 2 years. When I started, we built the program up to where I have about 150 patients that I manage the care of on a monthly basis now. And it's been incredibly beneficial to our practice and to our patient outcomes. The biggest reason being the better care that your patients are getting. It also is a service that is reimbursed by Medicare, so it benefits the practice financially. And because we have delivered such excellent care, we have seen our practice grow and therefore the chronic care management program grow. First thing I want to talk about is the improved quality of care that patients are getting. Each month I spend 20 minutes on the phone with patients discussing their entire health care and as a whole. I look at things like their lab results, and I'm able to spend focused time discussing those lab results with the patient. We do disease process education, and we track things like referrals and ensure that they are completed from start to finish. And anything else that the patient might need me to work on each month. They are very grateful for the fact that they have one person designated in the office that they can count on to ensure that all of their needs are met. And care gaps are closed this way, and much less things fall through the cracks. And I know you might be thinking, this sounds great, but how will this affect the overhead of the practice? So the other thing I'd like to talk to you about is the fact that this will benefit your practice financially. When your clinical staff member spends at least 20 minutes on the phone with a patient each month, this is a billable service. Medicare pays $40 per month for this service. And because Medicare covers 80% of that, this only leaves the patient with an $8 copay. And most of the time, your Medicare patients will have a secondary insurance, which will pay for the additional $8. So this is a service that most Medicare patients will not even have to pay for, but it so greatly improves their healthcare outcomes. Also, Advantage plans pay for it as well. So you can cover the cost of your clinical staff member and bring in additional income by billing these patients and building your program. And that leads to my final point. Because your patients are happier with their care and more satisfied with their care, they are more likely to tell their friends and their peers in the Medicare population about the care they're receiving in your office, which will bring additional patients into the practice and grow your practice that way, and you'll be able to then subsequently grow the chronic care management program. So I would ask you, what do you want for your practice? Do you want to see your practice grow? Do you want patients to receive the best possible care? I promise that by implementing chronic care management, you can improve your patients' outcomes, you can grow in numbers and grow in business, and grow your program financially. Your patients will receive better care than they are currently getting because of that focused time that they are getting from your clinical staff member. And I would ask too, is this a service you would want offered to your family members? Because I can assure you that it's been very beneficial to even my own family. So, do you guys have any questions for me?
What are some of the hurdles you've experienced in building your program?
I would say when we were first trying to build the program, we tried to recognize Medicare patients that might benefit from this service, and we would call them and discuss this with them over the phone, and they were very hesitant. However, when we involved the provider at their office visit, and the provider would talk about the service to them, then they were much more interested and willing to see how it could help them. So I don't believe it's a service that sells over the phone. It is something that you need to introduce to the patient in the practice.
How do you document for chronic care management?
Most electronic health records include now a method to document chronic care management inside the EHR, so you wouldn't have to pay anything additionally. I personally use SmartLink because it times and tracks the time I spend with each patient, and I do think that that's a program worth looking into if you're going to consider chronic care management.
Does the chronic care manager have to be an RN?
In the beginning, it had to be a licensed provider, and Medicare now recognizes that it can be any clinical staff member, whether that's a medical assistant, an RN, or a licensed clinical social worker. All right, well, I've provided you with handouts on the table here. They have my contact information, and so if you have any additional questions, feel free to email me, and I'll be happy to address those questions. So thank you for your time. I appreciate you being here.